Hello everyone, I am Professor Roopali Khanna. I am from Department of Cardiology. So if you ask me eating healthy, eat whatever which is not present in a can, if you ask, in a simple word. If you see all the canned or processed food, they contain a very good high amount of salt, because if we want to preserve a food for a longer shelf life, we need to add salt or some have an acidic nature. So if you want to control your blood pressure, stop all the packaged food which comes in packets. Take a healthy lifestyle, we call it a DASH diet. What is DASH diet? DASH diet, having a good green leafy vegetables, good amount of fruits in your diet, avoid high intake of salt, and have good amount of water intake. Our body has a mechanism to lower the blood pressure. So if you see, as with age, it's a normal thing, the arteries become stiff. So it's a normal phenomena when the age increases, your artery becomes stiff, your blood pressure will increase. That's a normal thing. If I ask me, a 20-year-old having a blood pressure of 100, 110, the same person at 60, 70 years will have a blood pressure of 140 or 130. That is like a graying of hair, which we say arteries getting stiffened. But problem comes when at young age you develop blood pressure. So if you're having a young age, at the age of 30 years, 40 years, you develop blood pressure, that is more related to your lifestyle and dietary pattern. Plus a genetic factor, because genetic factor we cannot control. If the hypertension runs in your family, the father has hypertension, your mother has hypertension, we cannot do much. But your dietary pattern and lifestyle are the two things which can be modifiable, which can maybe delay your hypertension or delay your increase in blood pressure. So we all say that any deep fried food which has been fried again and again, don't take it. So if you take these type of deep fried which have high amount of trans fatty acid, palm oils which have high amount of trans fatty acid, don't take that, because that are considered to be a bad lipid raising agents. So that will increase your LDL cholesterol. For lowering it, it's basically there is still very confusion. There is no clear cut recommendation that which oil is considered to be better. Is it your olive oil? Is it your sunflower oil? Is it safflower oil? We really don't have a clear cut analysis comparing each oil to each other. What we usually in our patients, we recommend, take a oil, you can mix and match your oil. You can sometimes take a mustard oil, sometimes you can take your sunflower oil, but take in moderation. That is what is recommended. Don't take deep fried foods. If you want to cook a dal or vegetable, don't try to make it, what we say in a common language, that oil is just floating over your food. Avoid that. And for increasing the HDL, that is a very challenging thing, because it is mostly controlled by genetic factors. But there are some foods which we say that have a good omega acids in them. Like if you are a non-vegetarian, this fish is very good source for having a omega acids, and which increases your HDL levels. And otherwise, the nuts, in which specifically your almonds are there or walnuts are there, which are considered to be increase your HDL levels in these cases. But the amount, or if you ask me, the percentage of increase in HDL would be very low. The second thing, HDL has been shown if you go for a good walk. If you take at least 30 to 45 minutes daily brisk walking, that has also shown that, okay, your HDL improves in these cases. So particularly diet pattern, the same old what our parents or grandparents used to eat, we have to come back to that. Stop packaged food. Anything which is coming in plastic, don't take it. So that is the first advice which we will give it to the patient. The other would be like, you can continue, you can, like, suppose the biggest challenge which we are facing is, now most of the youngsters, they are working in metros, they are living alone. So the food quality which they are taking, we all are aware, this is a very practical phenomena, they don't get a home cooked food, which our parents or which our mother, cook for us, in which, you will have a good amount of salt, good amount of spices, and good amount of oil. What we are seeing is now they are taking food either from your food apps, or the cook is also cooking in a very fast way, which is, most of a processed one. So the biggest advice, if possible, have a home cooked food with you, and at least have a 30 to 45 minutes of exercise. Otherwise, what commonly we see, patients says, I'm working in a corporate sector, I walk regularly, I don't sit on a table and chair, my job profile is that I have to run everywhere, but that will not help you. Why I'm saying this? Walk for 30 to 45 minutes brisk walking, in which your heart is really, pumped up. Like if you want to go to a gym, you want to make your muscle, what do? You lift weights, and then only when you put your muscle to exercise, it will become strong. So if you're walking just casually or just loitering around, your heart rate will not increase. So your muscle will not be very effective. So what we say, if you're going for a exercise, go for 30 to 45 minutes in which you jog, you should sweat, your heart rate should increase. It should not be like, okay, just walking around. So if your heart rate is increasing, that means you are working a lot. So if you don't suffer from any heart disease, and if you're a normal, physically healthy person, go for a walk, do jogging. And that are two main advices which I give to all youngsters who come to us, especially those who are living away from your family, because they have mental stress, they have physical stress, and the biggest is the diet which they are taking. See, our body, God has made our body in a very balanced way. If you see in summers, what happens? We sweat a lot. We drink more water. If you see our homemade, we used to make, aam panna and all that, used to have good amount of salt and that. When you're in winters, you don't take these type of drinks because of nature has not given them at that time. Mangoes will not come. It can make a aam panna for us. So a good amount of salt that we say, don't take table salt. What do you mean by table salt? If you have a salt can on your table, you will put in your salad, you will put in your curd, you will put over your maybe some vegetable. Avoid that. A normal salt which is used during cooking, either in the form of your dal, vegetable, that is the adequate amount of salt which is needed. Added salt in the form of pickle, your salad, your papad, your chutney, you should avoid that. Second, don't decrease the salt too much. What I see sometimes, elderly patients who say, I have blood pressure, I have stopped taking salt. That is also not correct, because we have seen patients coming to us with hyponatremia. What is hyponatremia? Low sodium content in the body, which is more dangerous in these cases. So what we recommend, take a salt in a regular diet, but avoid table salt. That should be the ideal thing. So excess of too much and less of it is also harmful for our body. See, we are sitting on a ticking bomb, if you ask me. We Indians now, in past 10 to 20 years, if we see the demographic profile, the cardiac patients who are coming to us, they are coming younger. And that is the biggest problem which we are seeing at this juncture. And if you ask the basic reason for having these type of cases, because every day in news we see one young patient, 20 years, 40 years, had a cardiac arrest. Why this is happening? We have to understand this thing. Our lifestyle has totally changed what it was 50 years back. We used to go for walk. We used to do cycling. If you ask someone, they used to go to work by cycle. And now, if you see, our physical activity has become zero. The work stress which our youngsters are facing is too much, whether it may be a corporate pressure, whether it is other jobs which they are facing, their mental stress and physical stress is taking the toll on them. Then third most important, the diet. They are living alone, the families have become smaller, they have stress, they are not able to, open their heart with their elders, with their parents, with their siblings. We don't have siblings now, if you see. So we don't have the, going for went out phenomena, which we say. This all is taking tolls. And the addiction. The smoking, which was considered earlier, we have declined in maybe in 2000s. Now it has again picked up. We're seeing youngsters coming with smoking addictions, all that. So the basic message, have a healthy lifestyle, go back to your roots and do physical exercise and laugh. Laugh is the biggest medicine which can improve your heart health. Thank you.